The future of medical imaging, AI and beyond.
Nice to see you. Here in Malta, where history and innovation comes together, we already had exciting discussions about the innovation, different parts, how to prepare doctors with tech for the future. And now we have an equally thrilling discussion about future of medical imaging, radiology, digital pathology, and beyond. And we're looking forward. We will glimpse an eye how the future might look like. And we have really interesting panel guests here. I'll briefly introduce myself, then we go to our guests. I'm myself Ilya Vedgruber. I'm a moderator, and previously I was a physician. I glimpsed into radiology, but then I switched careers. I also started coding, and my first AI solution I developed 10 years ago. It was in radiology. It was predicting survival rate of cancer patients, and now 10 years later, the landscape has changed dramatically, and we have really astonishing speakers who are at the forefront of innovation in medical imaging, radiology, and etc. And I'm excited to talk with you. And we'll start with Farzana Rahman.
Hi.
Hi.
Hi, I'm Farzana. I'm a radiologist by background. I used to be a consultant radiologist, so an attending at University College Hospital in London, as well as working at NHS Digital. I set up a company a few years ago with 3 other radiologists called Hexarad.
And you're you're on a vision like to enable accurate diagnosis for everybody and everywhere with Hexarad, yeah, right?
Yeah, we have a radiology platform, and we offer both teleradiology and workflow management software.
Okay. And may I just combine a question with you first and then proceed with everybody? Can you share some insights? How do you think AI is transforming landscape and radiology to benefit patient care, to fulfill your mission, to enable everywhere and anywhere to have the vision fulfilled of Hexarad? How do you feel it?
So I think the question was how to kind of achieve that mission.
Yes, right.
Something we're still working on, but I think conversations like this, I think an acknowledgement that we're talking about AI, which is really interesting, but actually if you're looking at not only the developing nations, but in the developing countries, we're still fairly far behind on tech capability, and that's kind of less sexy than AI, but that's an important thing to consider.
Yeah. Okay, and less sexy technology is Franz Pfister. You are like a dual specialist. You're a physician and you're also a data scientist yourself. And with your company DeepSea, you turned entrepreneur. And your mission is to create scalable impact on healthcare through digitization. May I ask you first to introduce yourself, and then could you give us some real-world examples of AI and how does it impact or the benefit for radiology in the clinical pathway?
Yeah. Thanks a lot, Ilya. Great to be here. So first of all, very nice to be here. I'm Franz, Germany, neurologist and data scientist, CEO of DeepSea. We have built a software infrastructure layer, which we believe is pretty important for data and AI and radiology to make the evaluation, deployment, and monitoring of AI solutions in that field much easier for clinicians, for IT staff, for hospitals, but then also for the AI developers themselves. And obviously, we already see a lot of different real-world examples how AI can bring clinical value already in workflows today. One of the great examples might be in mammography breast cancer screening, but this is just one of many examples where we now have more and more clinical proof points and validation studies from multi-center investigations, where in the Nordics there is first proof points that the second reader could actually be augmented or replaced by AI. So you would really become much more efficient, relieve the staff shortage in that field, and create a tremendous value for the patients at the same time.
Awesome, really fascinating. Thank you. Diving deeper into it later on. Now we came to Ilan Adler. He is also a fascinating entrepreneur of One Imaging, and he is developing a groundbreaking initiative that offers radiology as an employee benefit to bring value-based care to healthcare. And he has also a background at Cleveland Clinic. He worked at Siemens at the MR division, so he's deep dived into it. And I wanted to ask you, how is AI technology revolutionizing in terms of decreasing the costs and being cost efficient in the clinical practice?
In the clinical practice?
Yeah.
So I think that, and thank you for having me here, by the way. I think that in the clinical practice, the way we need to look at AI is with time. Time is our biggest asset, right? It's the one thing that we can't buy back more of. So in the clinical landscape, one thing that I led at Siemens was the commercialization of remote scanning technology. It was of AI segmentation software, but more importantly, as we look in the imaging side with whether that's Viz.ai, Rad.ai, AI Doc, what are we doing here? We're decreasing the time that it takes radiologists to create a read. What are we doing on the acquisition side? That's on the read, right? We're never going to replace radiologists. That's not right. But what we can do is allow them to have a higher workload without burning them out and having more productivity by having more time. But in the acquisition side, right? How are we the people who are taking the pictures? We can now have up to 70% reduced scan times with things like deep learning technology, Air Recon DL from GE, Deep Resolve from Siemens. And then really, in my opinion, what I do at One Imaging is reducing the cost on the administrative side. So how do we compress administrative costs between payer, patient, provider, where we don't have multiple paper payments? That's a huge problem in the US, more so, but on the clinical side, I think it's really around buying back time that wasn't there before.
Awesome, thank you for the insight. I'm looking forward to hear from Sahir Ali. He has a diverse background as well. He is an inventor, engineer, scholar, and now he's managing his own investment fund. And I'm particularly eager to know what kind of AI solutions in radiology are fundable right now, which means which solutions have the most benefit, and that's what's the reason why they're best fundable. What do you think, what kind of topic is more fundable?
Good to be here, first of all. So you asked what's fundable. When it comes to medical imaging and AI, I think there's a little bit of downturn, I would say, a little bit. And that's driven by, I think, a couple of trends. I think investment world is very driven by patterns and sort of hype cycles. And so currently the hype cycle is how do we leverage these large language models? These are low-hanging fruits of workflow improvements. And so you'll see that, especially in the United States, the traction that sort of medical imaging and the intersection of AI is seeing is improving these workflows. How do we generate reports like the Rad AIs of the world, and not so much on the diagnostics parts, because first of all, the reimbursements are not clear and things like that. But I guess if you ask me what's beyond all this, which I think we all are not looking at, is that when we think of medical imaging and AI, the first question that comes up is, what does it do for radiology, or what does it do for pathology? But beyond, I think this, because of what's happened with large language models and the idea of taking sequences and coming up with something in the latent space that is unprecedented in a way that we can start to characterize disease like we haven't before. So it's not about, I guess I would say a controversial statement, it's not about the radiologists. It's really about what can we do for patients. And with, which becomes more fundable in my mind, is how do we actually start to go cross-domain and start to characterize disease better? So for example, take from radiology to pathology and incorporate omics in this. And so now you can go after this aggressive disease and really start to do precision medicine. So I think that's where my focus would be as an investor.
A really broad view. Thank you for the overall description. And also, Fasana, something we also talked about is, you said it's so much focus on diagnosis, but there's so much more in neurology. How do you perceive this? What should be shed more light onto it?
So I think Franz and I were having a really interesting discussion. And I think coming back to your point, Ilan, about how do you make radiologists faster? And that's a really interesting question, right? Because as a radiologist, when you sit down, there are lots of things that have to happen before you finally make that diagnosis. And what, from a clinician perspective, what I look at is, you're seeing some AI tools, and some of the workflow ones are fantastic, but some of the diagnosis ones, they don't actually make you faster, right? So, and some of the paper was published in the last couple of months which demonstrated that. Does it mean there's no value? Absolutely not. But I think coming back to your points here about fundable models, unless you demonstrate like an ROI, so you have a very easy, this radiologist can now get through X percentage more work. If that's not the case, because we were saying that there's one very well-known AI tool where you have to copy and paste the report into your final electronic health record, that's insane. But that is the reality that I think until you get onto the ground and you solve these messy problems in the NHS, sometimes, there aren't teams that can do networking. You don't have good Wi-Fi. The quality of the servers you have in hospitals aren't good enough. I think until you solve those problems, you don't see the end results that you're hoping for when it comes to diagnosis.
If we were in the US, I would simply create a copy and paste tool that does it automatically, and that's the beauty of entrepreneurship there.
Sure, but then in Europe, you're going to have to get across, again, another layer of governance and regulation.
It would be a whole company just to do that.
Yeah, exactly.
Yeah, thank you for shedding light on it, and it's important to mention it. And also interested to know what Franz thinks about it, because of your dual background as a clinician and a technologist. What do you think about this, what Rosanna said about ROI, bringing more into the ROI aspect, into AI and medical imaging?
Yeah, I think we had a very good panel discussion before the actual panel about infrastructure and integration. The cool and sexy part is actually building AI and doing the deep learning part. We did that years ago, but then we realized that actually there is so much work to be done to actually make AI effective in clinical workflows that might not appear that sexy, but it's really, really important on the infrastructure side. How do you actually connect the different systems? How do you get the outputs of AI results into reports? How do you get it into work list for prioritization of cases, etc.? So it's really that plumbing and the infrastructure that's not there at this point in time. To your point, we see more and more commoditization of AI tools per se. So we will see less and less product differentiation between vendor A, vendor B, vendor C, but it's more about how do we actually integrate with existing workflows to actually realize the actual ROI in clinical workflows. So does it really have a huge benefit to have a PDF report which contains a lot of great measurements, which contains a lot of very useful information, if you then as a radiologist need to dictate this information into your actual report? Of course not. So you're losing actually time and you're not gaining any efficiency. And that's what you can solve with better integration and really smooth integration and infrastructure.
Totally, because as a physician, you want to have a solution for everything. You don't want to lose time switching the solutions and figuring out how does it work. So integration is well a vital part. And interesting that you shifted your focus after developing your first AI solution. And which brings me to the next question. I wanted to ask Sahir, as we heard, not every solution is connected, integrated correctly, which brings me to think there are also other countries and other worlds where the solutions are not implemented as far as in our European countries or in the US. What do you think? Is there a big gap, and how can be this gap minimized?
Well, there's a huge gap. So first of all, I think medical imaging has a long tail problem, and this long tail exists in pretty much every domain. So what's the long tail problem? Medical imaging is the third most gathered data in the world. So you have billions of X-rays and millions of CT scans, and all of this data, you'd see it's a large data sets everywhere, but it's vast majority of this data is actually not useful. There's nothing interesting about them. They're benign, and so what becomes interesting is the long tail. And so that long tail data, no one's sharing. So this is where you have the rare cases you will see. So in fact, in breast radiology, if you look at mammograms and so the white blobs, what are the chances a radiologist in their lifetime have seen something with 5 millimeters and above? And these are rare cases. Even human radiologists or even pathologists, I would also include digital pathology in this. The rare cases are not there. And so if we want to advance this, so first of all, algorithmically, we need to be able to have sort of infrastructure where the data is shared, where I think, in my opinion, there has to be a company that starts from the principle that how do we actually enable hospitals or data owners to become their own product, rather than asking, like, give us the data, which is what IBM Watson did, and we're going to become the data product. Can we enable them somehow to become the data product, keep the data on site? I mean, there's Hawkins and folks doing federated learning, but still a challenging problem. So that's first. How do we actually go into the long tail of this problem? Because just having big amounts of data necessarily doesn't mean anything, because you're going to have class imbalance problem. I think the second problem in this space is infrastructure. So yes, medical imaging has DICOM, which is a pretty standard format, but how you plug that in is very different for state by state in the United States, country by country. Most hospitals do not have enterprise systems and things like that. So I think these are some infrastructure issues before we can even say, how do we deploy these things?
Exactly. I loved the comparison, because what I always say is you can use your ATM card anywhere in the US or in Africa, but if you want to have your clinical data read at the hospital across the street, it's often not possible. And I'm interested to know, Ilan, because you developed full body protocol scans for MRI imaging, and so you somehow found a way to work with the data, monetize the data, and just a short discussion or a short insight about full body scanning. What's the future of it?
So very, very controversial topic right now, I think, in the United States, as we're seeing people like, Kim Kardashian post pictures getting Pernuvo scans. So once upon a time, I used to develop radiology protocols for a company called Ezra, which is a precursor. And I think it's more like a long tail problem for starters, right? Which is what? Meaning that you need a ton of MR data to be able to use AI to interpret and help with diagnosis. And getting MR data is much harder because the scans are so much longer than a CT scan. So because it takes 30 minutes an hour to do one full body scan compared to one full body CT scan, which would take 30 seconds, it's much harder to create that data long term. And then I think we also have to start to look at, like, okay, what's the efficacy? Are we finding incidentals that create unnecessary biopsies, which have more complications than positive outcomes? So how can we utilize this technology to look like a sci-fi movie, where maybe we're replacing annual physicals one day, where people aren't pressing on your stomach to find out if you have a cancer or if you have, any type of abnormality. You could just look inside your body real quick. Now, there's huge potential ramifications and huge potential there. It's just if we're using this information correctly and creating a really full picture and making the best assessments, which we're going to need a whole nother AI segment there just to create a full picture of the data, not the actual pictures themselves, but of an entire human's structure, their whole makeup. What is worth it and what's not? From what you're gathering from the data of a full body scan.
Well, thank you for the insight. And listening to your words brings me to think about the future. And actually, as our panel is closing, I want everybody to give the chance to say two, 3 sentences. What do you envision the future of AI neurology in 5 years? So 2028, what trend or what technology would have sustained in neurology, and how do you see? Like just 2 to 3 sentences.
I think there'll be a consolidation in the tools. I don't know if it's a good thing or a bad thing, but I think much like how you see PACS manufacturers or EHRs, you have these like 2 or 3 tools that jump ahead and consolidate. I suspect that's what's going to happen. Do I think that's going to solve a lot of problems? Probably not, but I suspect that will.
Okay. Thank you.
Happen.
Yeah, 3 things. First of all, consolidation of tools, I fully agree. Second of all, what will stay is the infrastructure, which is what everything has in common. And the third one is, I think we still do not realize the full potential also in regions that we might not think about today. Like in countries like Germany, UK, or the US, radiologists might have a really, really high standard of reading quality already, but there are other underserved regions on this planet where there might not even be a radiologist. So the actual potential that is untapped is much, much higher. So focusing on that a little bit more.
Thank you.
I'll piggyback along to what you just said. I think access to care is going to be incredibly increased, right? We can read images from anywhere. We're going to decrease costs. We're going to be able to bring radiology to rural areas in different countries around the world, especially in the United States, with the decreased footprint. And if we have any material science changes somewhat similar to the room temperature superconductor, I mean, think about how much more it's going to unlock. So I think we're going to improve access to care dramatically.
Thank you.
I think my future predictions, or I guess what I'm excited about, is going beyond just, I guess, medical imaging, because we start to think ologies and these departments and sort of how do we slice and dice in different ways the data that's present in our bodies. But disease is not in that manner. Disease is characterized at different length scales. So you have a three-dimensional view of that through MRI, but you also have two-dimensional views of digital pathology. You also have tabular structures coming from genomics data. All of that data is being collected. What we don't have is a sort of a mechanism that actually collapses all of this and gives a unique signature of the body that could be trended. And that, to me, is precision medicine. And so imaging becomes a big part of that, but it's not the only thing. So we'll leave that.
Thank you for the statements. Thank you for being part of it and for navigating through this complex area of technology, AI, and radiology. We are all looking forward to the future, what's hot for us, and thank you for the discussion.